Good afternoon, everyone. Hope everyone's having a great Thursday. I am about to get started on the Thyroid Awareness Month webinar. I'm just going to educate a little bit about what's going on with thyroid disorder and what symptoms to look out for, what tests you should be looking out for, and also a little case study. So let me jump right in. The first slide here, did you know that 1 in 10 people suffer from a thyroid disorder? And 1 in 8 women develop a thyroid disorder during her lifetime. So more than half the people in the US have suffered from an undiagnosed thyroid disorder. It's it's more often than we think. So there we go. And so there's types of thyroid disease. There's hypothyroidism and hyperthyroidism. And there's different symptoms associated with both. Hypothyroidism is the more common one that we see. That's where you see symptoms like fatigue, weight gain, cold intolerance. Like a lot of my patients say, I'm always so cold, or like my hands and feet are so cold. Dry skin, hair loss. Particularly, like I also see women who lose like the outer 1/3 of their eyebrows. That's also considered a thyroid symptom, as well as constipation. And then the autoimmune disease of hypothyroidism is Hashimoto's. And then the other one is hyperthyroidism. That's when the thyroid is putting out too much of the hormone. And that's where you'll experience weight loss, sensitivity to heat, anxiety, palpitations. And then the autoimmune version of that is Graves' disease. So a common telltale sign is like bulging eyes that you'll see with those types of patients. And then here is a little picture. So the thyroid is called like the butterfly gland. It has the shape of a butterfly. And the way that thyroid gland is made is, or the thyroid hormone is made by the thyroid gland, is that the hypothalamus stimulates the pituitary gland to put out TSH that stimulates the thyroid gland to produce T4 and T3. Now, T3 is your more active form of thyroid and is also converted in the liver. So T3 and T4 regulate metabolism, body temperature, digestion, brain function, mood, energy levels, heart rate, weight, and blood pressure. So you can imagine, like, it's kind of a whole body. It affects your whole body if your thyroid is off. And of course, like, I didn't really put this on the slides here, but I can talk about it a little bit. The adrenal health plays a big role in your thyroid health because adrenals have a communication pathway that they have between the hypothalamus and the pituitary and the adrenals called the HPA axis. And so when there's a significant amount of stress or chronic stress that's going on, that adrenal gland, those are telling that HPA axis feedback loop, like, hey, we're under stress, and that goes and tells the hypothalamus and the pituitary in the brain that this is going on, which can definitely alter the output of your TSH and also then in turn affect the conversion of your thyroid hormone. Okay, so the next slide is most common, of course, like I mentioned before, is hypothyroidism. And typical labs that I run for checking thyroid: TSH, which is thyroid stimulating hormone, free T3, which is the active hormone, free T4 is the inactive hormone that can be converted into T3. And then, of course, if autoimmune is suspected, then the TPO antibodies and the thyroglobulin antibodies. And then, of course, reverse T3, which is the inactive T3. And then additional things I do like to test for is cortisol and vitamin D, just because, just like I explained earlier about the HPA axis and how that whole pathway works, cortisol does play a big role in your thyroid health. And then I've just got some sample results there for people to see like what my tests look like and that sort of thing. And then of course the cortisol graph, which is very useful. So the thyroid has to be through blood work. Cortisol, I typically run through like a saliva test. Thyroid and vitamin D is through blood work. And I will be doing questions at the end because I think I have everybody muted. So anyways, here is a case that I have worked with, a 44-year-old female. She's having difficulty losing weight, particularly around the belly. She says her skin's been really dry and hair loss and little thinning around the eyebrows. She works out a lot, 5 times a week, and eats mostly salads and lean proteins. She's just tired all the time. She eats broccoli because she's been told it's good for her. And then after I took her medical history, I discovered she's under a lot of stress. And then, of course, we did that thyroid lab testing and her cortisol. As you see, her TSH is elevated at 5.6. I like that number around 1 to 1.5. The free T3, free T4 look okay, and the vitamin D is very low. 18. I like that number around 50. So just kind of taking a look at those, we can definitely see there's some thyroid dysfunction going on. And then looking over at the cortisol graph, she's in phase 3 adrenal fatigue. So you want that little black dotted line where it's kind of down there in the blue area, you want that to be kind of in that green area. So you want it to kind of flow throughout the day where you have more cortisol in the morning, but as the day goes on, we start to wind down. So there's definitely some thyroid dysfunction going on with her. And so now I'll talk a little bit about what foods I recommended for her and treatment protocol. So how to support the thyroid diet, you want to eat whole unprocessed foods like veggies. Bone broth is very healing to the gut. Beans, kidney, and navy particularly. Nuts and seeds, all kinds, but walnuts, pumpkin, and sunflower seeds are great. Coconut oil, in moderation. You know, coconut oil is higher in saturated fats, so I don't recommend eating it all the time or a ton of it, but here and there it is good for you. Wild-caught fish and shellfish. Seaweed, be careful if you have autoimmune with too much iodine. Lean meat, eggs, lemons and orange, honey if it's raw and unfiltered, and fruits. A lot of times, supplement-wise, I recommend supporting the adrenal glands. Ashwagandha is an Ayurvedic herb that helps to regulate the adrenal glands and regulate cortisol. And then, of course, support the gut with probiotics, chamomile, fennel, ginger, vitamin C, selenium. And then, of course, we do have other blends of thyroid supporting supplements at the office if we need to do a little bit more additional support. And then foods to avoid if you have thyroid disorder. So a lot of people don't realize, of course, fast food, that's one, but raw cruciferous vegetables. So that's going to be like your broccoli, your bok choys, cauliflower, things like that should not be eaten raw. You can eat them, just make sure they're cooked. So those are some of the foods that a lot of people don't realize can affect thyroid because they're goitrogenic, which can actually cause more thyroid dysfunction. So we don't want that with hypothyroidism. Soy, gluten, other processed foods, refined oils, carbonated soft drinks, caffeine, alcohol, sugar, especially if the sugar is refined, and unfiltered water. So those are just foods that you should try to minimize and avoid as much as possible if you have thyroid disorder. And then I've just got like an infographic picture here, you know, foods to eat for a healthy thyroid. We've got nuts and seeds, we've got kidney beans, we've got some healthy salmon, avocados, eggs, and then just the opposite for the foods that you should only eat cooked: cauliflower, broccoli, Brussels sprouts, spinach, cabbage, those types of things, to only eat those foods if they've been cooked. And then a huge, huge, huge portion of thyroid health has to do with stress management. A lot of disease can be related to just stress management. Setting a routine for yourself can help with that. Exercise, meditation, gratitude, breathing exercises, eating healthy, setting healthy boundaries, finding a routine that really, really works for you, and knowing when to say no, and giving yourself the time to relax and also feel that you're full. You cannot give from an empty cup. So if you do not feel like you're rested, then you're not going to feel well, and you're going to have some kind of issues arise, if not now, in the future. So really, just not only for thyroid health, but for all types of health, just overall health, it's important to focus on making sure that you take care of yourself. Stress management is huge with thyroid health. And then, of course, with our patient, Jane Doe, after implementing the recommendations and she started eating well, she took out that broccoli unless she was cooking it, she lost weight, her energy improved, her hair started growing back, her skin improved, and her lab results normalized. Her TSH went into the normal 1.5 range, and the others stayed normal. So just everything was getting better. All right, so I will open up to questions now. Let me see if I can unmute these so that if anybody has a question, I can, let me see. All right, I believe everybody's unmuted. I hope not everybody is talking over each other, but can I answer any questions?
I do have a question.
Uh-huh.
I am still treating with Thyroid, and I have always read that people with Hashimoto, they do better with Armour.
Yes. In my clinical experience, I have seen that. Unfortunately, in the state of North Carolina, I can't prescribe medication, but when I was practicing in Phoenix, yes, I have seen that my patients with Hashimoto's do better with that.
Are there studies that confirm that? Because endocrinologists, they really don't want to prescribe you Armour. I have asked like 2 times and they keep telling me no.
Right. It just depends on your doctor. There are no set regulations or guidelines on that. I think it's just based on what the doctor feels is right for you.
Okay.
Mm-hmm.
But as far as you know, people feel better when they are on Armour.
That's what I have seen clinically, yes.
Okay.
Yes. What other questions? If anybody has any other questions, then the floor is open. If not, then we are offering a free 15-minute phone consultation to those attending the webinar, as well as $50 off a new patient visit if you schedule by tomorrow. Usually we don't offer that much as far as a discount on new patient visits. So anybody who was on the webinar is eligible for that. All right, well, I hope everyone has a great afternoon. I'm going to go ahead and end the webinar, and then tune in for the next one next time. Have a good one.